the U.S., cases are trending downward overall, but a subvariant of Omicron is spreading in parts of the country and overseas.
The pandemic is not over. We call on all countries to remain vigilant.
What we're seeing with BA2 is not really any more severe disease. We do see that it is a bit more transmissible.
And the FDA says a panel of outside experts will meet next month to discuss booster eligibility and whether the U.S. will need another booster shot. Joining me live now, Dr. Yasuko Fukuda from Pacific Pediatrics in San Francisco to talk about recent COVID-related changes for children. So thank you so much for being here. I really appreciate it.
Certainly. Good afternoon. Thank you for having me on.
Absolutely. So with cases going down, we know the state is no longer requiring masks indoors in a lot of places. So I wonder what's your take on that when it comes to kids, because some of them, as we know, are still too young to get vaccinated.
Right. So I think the story with COVID is, of course, it's ever changing. The CDC came out with very clear levels of risk, low, medium, and high. And luckily in the Bay Area, we're in a low risk. And the things that we look at is how much disease do we have? How much are people in the hospital? Do we have room in the hospital? And immunizations. Those are all things to look at in terms of looking at if you're safe and if you should continue to use a mask or not. I think being vigilant on what is going on. And the other issue is, of course, I'm talking to kids every day. I ask them, how do you feel safe about what you want to do? And I think I would want to make sure that each child is feeling comfortable about their decision. They may have a younger sibling who can't get vaccinated. They may have a baby in the household. They may have someone that is high risk, is on cancer chemotherapy, and their immune system is suppressed. So those are many of the other issues that we have to look at in respecting every family and their choice.
You know, we're reporting stories of these outbreaks in other places. So I wonder, how concerned should we be? How should we be thinking about collectively this latest variant, this Omicron subvariant?
Right. So I really want to put a shout out to our public health departments, both nationwide, statewide, and locally. Everyone is really monitoring this, and to listen to those who are getting the data so that we know, is this a concern? Are we starting to have disease? And I think they're being very vigilant about making sure what's going on in your community.
And finally, I want to ask, a lot of parents have been really waiting to hear about vaccine eligibility for their younger children. Do you know anything about what they can expect looking down the line?
Right. So what we were hoping, the initial 2 doses for the children from 6 months to 4 years, showed after 2 doses that there was not quite enough of a response that we would like. So we have to be patient. They're studying the 3rd dose. I believe in the next month and a half or so, there may be more news. And I also can't promise that it's going to be effective. So in the meantime, not only get your COVID vaccine, but also get your flu shot, get your other shots that you need, measles and whooping cough, and we try to keep as safe as we can.
All right, Dr. Fukuda, thank you so much. We appreciate it.
Thank you.